Dr. Jaffe, what are your thoughts on red light therapy gaining a lot of traction these days?
Yes, red light therapy is very much in vogue. Red light goes a little bit deeper into the skin. And if you use it as part of a total regimen for skin improvement, you can show some decrease in wrinkles. But red light therapy is completely different from what I recommend in regard to green dichro light. Par 38, 150 watt, green. Dichro means that everything that is not green is reflected back and trapped, and everything that is green, the green spectrum, the green range of color, the green chroma, is retained. I therefore distinguish this beneficial green light from green bulbs, painted bulbs, or LEDs that have a few wavelengths but not the full green spectrum. I was taught this by a Cambodian Buddhist monk who taught much about how the sun can help you heal. And he discerned that these green light bulbs produced wavelengths, produced color that balanced something in the eye. And now I'm going to shift from the monk to other mentors of mine, including Jerry Lettvin, who actually did the following study. One of the levels of the retina, one of the levels of the nerve in the eye, goes directly to the deep brain pineal gland. And the pineal gland, to a large extent, works on the ratio of green to blue. And today we have generally too much blue and too little green. You can emulate green and enjoy green by going out for forest bathing and being under a canopy that is green with a blue sky, hopefully behind it. But remarkably, these dichro green bulbs, if you sit in front of them for 20 minutes twice a day, and you relax, or you meditate, or you practice abdominal breathing so you remember to breathe under stress, it is, in my opinion, one of the most profound self-care opportunities that exist today. It has been in use at least since the 1970s, at least. And actually, there is a venerable history to green light therapy and its benefits. One's comparison, if you use what's called a light box, say for seasonal depression, you might use a white light box for 4 or 6 hours a day. If you use the green bulb for 20 minutes twice a day, it's as good, maybe even a little bit better than the many hours under the white light. Dr. Norm Rosenthal at NIMH studied this and verified the value of green and the importance of green to blue, because the pineal gland is the mistress to the pituitary. The pineal sends messages through the hypothalamus to the pituitary, which tells the pituitary gland what releasing factors to stimulate the thyroid, the adrenals, the ovaries or testes, the pancreas, and many, many, many parts of the body. So very important. If you're fortunate enough to be able to garden, you would probably be getting more green that way. If you can walk in a park or a glade or outside in a woods, that's helpful. But when I travel, and generally daily, I'm under the green light for 20 minutes twice a day, just chilling. I might listen to classical music or madrigals. I might just muse. Or I might practice abdominal breathing, relaxation response a la Herb Benson, and mindfulness practices a la Bhante Dharmawara. So, with homage to all, with good wishes to all, may we all be well and happy, especially if we use the green dichro bulbs twice a day.